A&P students, and welcome back for our next segment of the cat vessel dissection. In this segment, what we're going to do is identify the vessels in the abdominal cavity, both arteries and veins, and look at the hepatic portal system. So what we're going to do first is move some of these membranes out of the way, and our assistant's going to move the greater omentum away here so we can view some of these vessels. So what you'll see are these yellow colored vessels, and again, I think I've mentioned this in previous videos, but the yellow vessels indicate the hepatic portal system. And notice I can kind of open up the small intestine here, and what you can see are these yellow vessels, and these are the veins draining blood away from the digestive tract organs that's going to eventually drain through the liver, hence the hepatic portal system. Alright, so note that these yellow, even though they're not blue, these are veins draining digestive tract organs. So for identification purposes, what I want you to do is definitely be able to identify the hepatic portal system vessels. They will be yellow, and also be able to identify what organ they're coming from. So note that this organ here is the pancreas, and of course this is the large intestine, and of course the small intestine. So you should be able to identify, we have the superior mesenteric, inferior mesenteric vein, and they lead into, and I'm going to pull this back some more because it needs to retract. You have some vessel branches here that are draining the pancreas, draining the spleen, draining the stomach, all coalesce into this main branch here, which is the hepatic portal vein. And if we were able to dissect further and trace up, you would see that that vein drains into the liver, which is here. Okay, so note that hepatic portal system. All right. So what we're going to do now is look at the arteries of the abdominal cavity. And what I'm going to do is kind of pull these intestines to the side so we can see those vessels. All right. So we've already went through the superior mesenteric artery. Down here, note closer to the inferior portion, you have the inferior mesenteric artery, and all of those branch off of the abdominal aorta. And there's the branch there of the superior. So you have the superior mesenteric, inferior mesenteric artery. Let's see. So next we want to identify the gonadal vessels. In this cat we can't identify the veins as easy, but what we can see are the arteries. And you see these little branches here that branch over. Notice they're going over towards, this is a female cat. So this is the ovary, and those gonadal arteries are basically feeding that ovary, supporting and supplying the nutrients to that ovary and the uterine tube, which is here. All right, so of course this would be the inferior vena cava, all right, the vein here colored blue, and the abdominal aorta. And as we move down, we'll note that the aorta tends to move to be on top of or anterior to the vena cava. As you can see that here, I'm going to kind of move the cat so you can be further up in the center of the video. And notice here you have some branches of the end point of that abdominal aorta. Note that that abdominal aorta starts to branch. And what you have here, kind of different from the human, is that you have the external iliac arteries branching, and then the internal iliac artery, and then there's a very center branch which is only one, it's not paired, and it's a tail artery. Okay, so you have the external and internal, external iliac arteries. The vena cava branches as well, a little bit more difficult to see based on the fact that it is deep to those arteries. All right. And so in this cat, we're having a hard time getting down to those branches. But what you can see, if we can, I don't want to break any of the branches there. These are a lumbar artery here. But if we go down into that vena cava, it branches into those veins there. All right. So let's see. So I think we've covered everything. We'll go back up and just review the renal artery and vein just real quick. So this is the kidney here, and of course there's two kidneys, one on each side, and you have the renal vein here, and it may be branched. All right, some kidneys, the renal veins and arteries branch before they enter into the kidney, and this one looks like it's branched. And then deep to that renal vein, we have the renal artery. So there's the renal artery and then the renal vein. And this, just for reference, is the adrenal gland. All right, so just a quick review: portal system, here's your superior mesenteric artery, inferior mesenteric artery, abdominal aorta, inferior vena cava. Thank you.